1 in 9 women suffer from postpartum depression in the U.S. It's estimated that every year more than 400,000 babies are born to moms who are depressed. The FDA has recently approved a drug to treat postpartum depression. This is the first drug that is specifically designed to treat this illness. It's called brexanolone and will be sold as Zulresso. It would be administered through IV and is said to work within hours. But it's still a new drug and there are some concerns with it, including how much it costs and side effects. So tonight we're talking a little bit about it, but most importantly about postpartum depression itself. Dr. Gregory Stamps from CoxHealth is here with us now to help us understand this topic. Dr. Stamps, thank you so much for being here. Let's get started talking about postpartum depression itself. 1 in 9 women, that is a number that startled me. I had no idea it was this common.
It is. 1 in 9 is probably a very true estimate of what the incidence of postpartum depression is. And it's even higher than that if you consider postpartum blues, which is kind of a milder form of depression that affects almost half of women within the first couple of weeks of having their baby.
And that is what we often call baby blues, right?
That is exactly what that is.
Can you tell me a little bit about the difference? How can you tell if a new mom has the baby blues or something more serious like postpartum depression?
The baby blues typically is self-limited just for the first couple of weeks of the pregnancy. And of course the first couple of weeks of a pregnancy are very challenging, especially for a new mother, because there are certainly expectations that she may have had, and then dealing with a newborn baby and the lack of sleep and the hormonal changes that go on oftentimes catch people off guard, and that can result in anxiety and crying and loss of sleep, and those things are actually fairly common during the first couple of weeks, but if they persist longer than a couple of weeks, then we would consider that more in the line of postpartum depression.
Are there any risk factors, or can this happen to anyone?
Yes, there are certain risk factors. Of course, any history of depression would certainly put somebody at risk. And then depending on the situation at home, certainly a mother who is single, a difficult pregnancy that has had complications, or a baby that may be in the hospital in the intensive care unit, those are certainly things that would increase the risk of postpartum depression.
How does it impact the mom-baby relationship if a new mom is going through postpartum depression?
Well, of course, the bonding experience can certainly be affected. The nursing seems to be helpful in regards to helping with that bonding. So just to impact the mother's overall health, because if she's not sleeping well, if she's not able to care for herself well, if she's not able to eat, if she's not able to get up and around, she's not going to have a very good opportunity to take care of that baby either.
And how is postpartum depression treated right now?
Postpartum depression is dependent upon the person themselves. So, for instance, it's very common right now that we do a screening process for mothers during their pregnancy as well as in the postpartum state to try to identify those mothers that might have postpartum depression. And depending on their situation, some mothers are more inclined to want to just take some more time, talk with their family, work things out. Some really do need actual mental health professionals to help, so counseling sometimes is helpful. And there are times that medications may be helpful also, but it's a very individualized circumstance for each person.
Now with this new drug, this is the first of its kind that is specifically for postpartum depression. And one of the things I saw that is also unique about it is that it works almost immediately within hours. Of course, this is a 60-hour treatment through IV, but women reported feeling better within hours, and that's unique about this. Do you think, did we take too long to get to this point? And what is your overall thoughts on this new drug?
I think this drug has potential. I think that it's going to apply to a kind of a smaller segment of the population that has postpartum depression. So due to its its cost. It's not going to be for everybody. And I really think it's going to be for those people that maybe do not look like they're going to respond to some of the more entry-level medications that we might use. And for those people that have severe depression, this medication may be of great benefit to them.
$20,000 to $35,000 per treatment is the estimate for this treatment. You said we might have a small population that might be able to afford this. Do you think this is a good step, then a step in the right direction in terms of specific treatment for postpartum depression? That maybe in the future we'll have something that's less expensive and more accessible? Yes,
I think it's going to be somewhat dependent on insurance and whether they're going to cover it. There's certain guidelines they may have before it can be used. I hope that on down the line that we have better medications available that work quicker, because typically most of the medications that we may use for postpartum depression take about 4 weeks. And so if somebody comes in and they have had a history of postpartum depression, and especially if they've been on medications before, it's very helpful that they share that with their obstetrician, because it may be very key to be proactive and consider initiating treatment before there's a problem. Also along the lines of medication, if a woman finds herself pregnant and she is on medication, please talk to, she needs to really talk to her obstetrician about whether she should or should not continue that medication. Don't stop the medication just because they have heard that maybe it's not good for the baby, because stopping medication and suffering from depression could be far more impactful than any of the effects of the medication on a baby. Dr. Stamps, thank you so much for sharing all of that information with us. It's been great to have you. Thank you very much for having me. And you can listen to our entire conversation on our podcast. Just search for Color 10 Ozarks Fox on wherever you get your podcast. We will be right back with more right after this.